Life can change in a second. One moment, everything is fine, and the next, emergency strikes. In those critical moments, what you do can make all the difference. In this video, we will discuss the essential first aid hacks everyone should know. Because being prepared isn't just about helping yourself, it's about being there when someone else needs you most. First aid is the immediate care given to a person who has been injured or suddenly taken ill. It aims to preserve life, prevent the condition from worsening, and promote recovery. First aid can be administered by anyone, and it could range from simple actions such as applying a bandage to more complex procedures like performing cardiopulmonary resuscitation. The primary goal of first aid is to stabilize the patient until professional medical help arrives. Some essential first aid acts that everyone should know include 1. Performing cardiopulmonary resuscitation, that's CPR. The ability to perform CPR could save a person's life in a cardiac arrest emergency. Chest compressions and rescue breaths can help maintain blood flow and oxygen to the brain until medical help arrives. Here is a step-by-step guide on how to perform CPR. Check the scene for safety. Before approaching the person in need, make sure the area is safe for both you and the victim. Check for responsiveness. Gently shake the person and ask if they are okay. If they do not respond, they may be unresponsive and in need of CPR. Call for help. If there is someone nearby, ask them to call for emergency medical services immediately. If you are alone, call the EMS first before starting CPR. Open the airway. Tilt the person's head back slightly and lift the chin to open the airway. Check for breathing. Look, listen, and feel for any signs of breathing for about 10 seconds. If the person is not breathing or only gasping, start CPR. Perform chest compressions. Place the heel of your hand on the person's chest between the nipples. Interlock your fingers and position yourself directly over their chests. Press down hard and fast, about 2 inches deep, at a rate of 100 to 120 compressions per minute. Deliver rescue breaths. Pinch the person's nose shut, cover their mouth with yours, and give 2 slow breaths, watching for chest rise with each breath. Continue with chest compressions. Alternate between compressions and breaths in a cycle of 30 compressions to 2 breaths until help arrives or the person begins to breathe on their own. 2. Using the recovery position. If someone is unconscious but breathing, place them in the recovery position to help keep their airway open and prevent choking. 3. Stopping bleeding with direct pressure. In the event of a cut or wound that is bleeding, apply direct pressure to the area with a clean cloth or bandage to help stop the bleeding. 4. Treating wounds. Knowing how to clean and dress small cuts, scrapes, and wounds could help prevent infection. Clean the wound with water and mild soap. Apply antiseptic and cover with a sterile bandage. 5. Dealing with burns. For minor burns, run cool water over the affected area for at least 10 minutes to cool the skin. Do not use ice or butter on burns. Cover the burn with a clean dry cloth. 6. Managing nosebleeds. To stop a nosebleed, have the person sit down and lean forward, pinching the soft part of the nose for at least 10 minutes. Apply cold compress to the bridge of the nose. Avoid tilting the head back to prevent swallowing blood. 7. Recognizing signs of a stroke. Remember the FAST acronym to recognize the signs of a stroke. Face drooping, arm weakness, speech difficulty, time to call emergency services. If someone shows these symptoms, seek immediate medical attention. 8. Providing first aid for choking. The Heimlich maneuver can help dislodge an object obstructing someone's airway. Stand behind the person, wrap your hands around their waist, and perform abdominal thrusts until the object is expelled. 9. Handling major strains and sprains. Use the RICE method: rest, ice, compression, and elevation to alleviate pain and swelling in sprains and strains. Rest the affected limb. Apply ice, wrap with a compression bandage, and elevate the limb. 10. Managing allergic reactions. If someone shows signs of an allergic reaction, help them take their prescribed medication such as an antihistamine. For severe allergic reaction, that's like an anaphylaxis, seek medical help immediately or administer epinephrine auto-injector if available. 11. Knowing how to handle a heart attack. Recognize the symptoms of a heart attack such as chest pain, shortness of breath, and discomfort in the arms, back, neck, or jaw. Call emergency services immediately and keep the person calm and comfortable. 12. Preventing heat-related illnesses. Stay hydrated, wear light clothing, and avoid prolonged exposure to extreme heat to prevent heat-related illnesses like heat exhaustion or stroke. Seek shade and cool off with water if necessary. 13. Checking for signs of shock. If someone is experiencing shock, such as pale skin, rapid heartbeat, or shallow breathing, help them lie down with their legs elevated and cover them with a blanket to keep them warm. 14. Knowing when to seek medical attention. While these first aid hacks can be helpful in many situations, it's important to know when it's time to seek professional help. If someone is experiencing severe pain, difficulty breathing, or any other serious symptoms, call your local emergency helpline or go to the nearest emergency room. Emergencies can happen when we least expect them, but with the right knowledge and a calm mindset, you can turn a moment of crisis into a moment of hope. Whether it's a cut, a burn, or something more serious, these simple first aid hacks could save a life, maybe even yours or someone you love. If you found these tips helpful, give this video a thumbs up, share it with someone who might need it, and subscribe for more life-saving advice. Until I come your way next time, I remain your next door nurse, and I'm just a knock away. I love you guys. I'll see you in my next video. Bye.